Well, I want to let you know that you have tuned in to Hawthorn University's Holistic Health and Nutrition webinar series, and I sure want to thank you for joining us as we welcome back Jonathan Posey for his presentation on legislative updates of holistic advocacy across America with what you need to know to practice in your state. Holistic health advocacy and protecting our rights has become a topic of very high importance, and Jonathan invites us to become aware of holistic health advocacy and encourages greater participation in protecting our rights. Jonathan is the founder, executive, and policy director for the Council of Holistic Health Educators. He brings over a decade of experience in lobbying, public policy, and grassroots activism in food and consumer safety. Jonathan began his career on Capitol Hill as a congressional aide, then moved to the private sector as a lobbyist, representing food and consumer safety firms, as well as other healthcare and tech interests. Recognizing the need for an organization that exclusively represented the interest of holistic health and nutrition community, Jonathan created a coalition of like-minded holistic schools to protect the practice of holistic health. This coalition then grew to become the council. So today, Jonathan's going to provide a legislative update for overturning restrictive laws in various states, and we'll follow this with an open Q&A session, so your questions are going to be really important and guide this discussion here today. So we encourage your participation as we talk about state laws and advocacy. And certainly we want to remind you that this is recorded as usual and be available for replay on our website in just a few days. We will likely go up to 60 minutes today for the presentation with your questions and answers. So just at any time, there's a question and answer panel that you have in front of you. So please take your opportunity to write your comments, your thoughts, your questions, and we'll get those answered for you best our ability. I'm your host, Paula Bartholomew, and with all that said, I want to welcome you finally, Jonathan. Hello.
Hey, Paula, you are one of my favorite people, and I am so grateful that Hawthorn joined the council. I'm really grateful for your support.
Thank you, Jonathan. Thank you for all you're doing too. I'm really grateful to have you with us again and presenting on such an important topic. So if you're ready to begin, I'm going to turn it over to you and mute myself until I'm needed.
Thank you. And so I just want to check, you can see the presentation full screen, everything's fine?
Yes.
Wonderful. Okay, thank you very much, everyone, for joining us this evening, or this afternoon. My name is Jonathan Posey. I'm located over here in Northern Virginia, so the time is a little different. It's about 7 o'clock my time here. This presentation is going to be a little compacted. We're going to talk about the different state laws that you're going to face across the country as holistic nutrition professionals, and also we're going to talk about what's happening in Florida. We just had a major victory there, but I wanted to keep things kind of short because I really want to throw it out to you for your questions. And I really encourage you that if there was a state we didn't discuss, or if there's a particular avenue of practice that you want to talk about, I want you guys to have that opportunity to ask all of your questions to your heart content. So without further ado, we'll get started on that. Click. So as I said, my name is Jonathan Posey, founder and executive director of the Council of Holistic Health Educators. I've actually been in DC now for 15 years, working on food and nutrition policy, born and raised in Georgia. As Paula said, I'm a lobbyist. I am also a grassroots activist. I train practitioners like yourself and schools and their staff to get involved in grassroots advocacy, get involved in the political process. In my spare time, I conserve and restore antique typewriters. As I said, I run the Council of Holistic Health Educators. We are a member-based advocacy organization. We are the only nonprofit advocacy organization that fights exclusively for our community. Thankfully, Hawthorn was so kind to join. Schools joined by small grants. We're also supported by public donations, stakeholder donations. For example, we have CrossFit is one of our big supporters. My primary job is to defeat any attempt by a state legislature to limit your right to practice and build your business. And that always comes number one. But we're also constantly looking for opportunities to change the law. And that's what we're going to talk about in a little while. So we're always defending, but we're always looking for new ways. And we're also trying to find other ways we can bring a return on advocacy investment for both our schools and for our practitioners. So we're always trying to figure out different ways to help you and grow this wonderful, wonderful profession. Now, if you go to holisticcounsel.org, you will find this wonderful resource of U.S. state law and policy. If you click on your state, you will get kind of a truncated, easier to read version of what that law actually means. And if you have any questions about that, of course, you can send me an email through our website, and my email will be here at the end. Of course, you can ask at the end. So first off, we talk about the green states. Now, the color map actually went away recently. The organization that had that color map, they got rid of it completely. I can't find it anymore, and people keep asking where to go. I'm not sure, but most folks understand green, yellow, red states, and so we're going to stick with that just so there's some familiarity. The green states essentially have no law restricting your right to practice. Some of those may have what's called a certification law. For example, California says that if you hold a specific credential, you can apply to be credentialed by the state as a, quote, certified practitioner. That's very, very narrow. It doesn't apply to us, but otherwise nothing else impacts our right to practice. If we look at other states like Virginia, again, there's nothing in the law that directs our right to practice, but they also go a little bit further to have a registration process or certification process, and also a very broad exemption specifically saying, hey, no matter what happens with this law, these folks are protected. There's nothing they have to do. The key point about these states is that they're voluntary registration certification. You don't have to get them. So that's really, really good for our community because we can pretty much do work up to our level of education within our scope of practice. I said the main elements: no license required to provide nutrition advice, guidance, or recommendations. There are some titles that you'll see: certified dietitian, registered nutritionist, but otherwise there's nothing else to have to worry about. Some of these states might have a dietetics board. Most of them do not. And even those that do have a dietetics board, often it is very dormant and nothing really happens. As I said about Virginia, Virginia has a certification law, but it's got this wonderful exemption. Nothing in this chapter, meaning the law, shall preclude or affect in any fashion the ability of any person to provide any assessment, evaluation, advice, etc. That is really wonderful, and that's the kind of exemption that the council fights to put into other laws. Now, it does say that you can't call yourself or advertise yourself as a dietitian or nutritionist without that certification, but otherwise you're perfectly fine. You don't have to worry about that law, and you don't have to worry about what it's going to mean for your practice. Now, the yellow states are title protection states. They're states that have broad exemptions and go really just a little bit further than your typical green state. It really lays out a law that generally either has a license or has a certification that is more written like a license. And what I mean by that is when you first look at the law of, say, Nevada or Utah. Utah's a really great example. Utah says you can get a license to provide nutrition and dietetics. But if you actually look at that law, the only thing that gives you the right to do is to call yourself a licensed dietitian. So green states, either no law or it's a very minimal certification law. Yellow states have a more expansive law that talks about more things within a scope of practice, may have a license that a person could get, but otherwise there's nothing that's preventing you from practicing, nothing at all. There's about 18 states that have these title protections. So I wanted to pull out Idaho as a very specific example. It's one we almost lost back in 2017 when the council first got started. The law in Idaho says that if you wish, you can apply to become a licensed dietitian. But that license, of course, doesn't prevent you or anyone else from practicing. Now, in reading this law, there's this part in red that I've added, that nothing contained herein shall be construed to prohibit the use of the term nutrition or diet as a descriptive term in connection with a person's occupation or employment. So that's one of the other kind of exemptions that we try to fight to get so that you can use those words and in your daily life, and you don't have to worry about if you put the word diet on a marketing pamphlet that someone's going to come after you. So those are the kind of really good things that we want to see. Now, the really tough states are the red states, the wait, doesn't quite look right. There we go. We only have 17 of these left because last Thursday, the council, thanks to Hawthorn's support and all the council member schools, we completely flipped the state of Florida. It's now a yellow state. So we can just get rid of that. And we did, and Maine as well. We got Maine last year. We'll talk about Florida a bit. So there's only 17 of these red states, these highly exclusive scope states that say you cannot provide any type of nutrition, diet, weight loss, guidance, recommendation, or advice without some type of a license. These are the really restrictive states that we hear about in the news. These are the ones that have full dietetics boards that are stacked to the gills with dietitians, that are going to send you letters if they catch you, or if they're going to try to slip into your talk at Whole Foods, or they're going to try to send you an undercover client, so to speak. These are the states that are really dangerous, and it's the ones that really the council spends the bulk of our time trying to flip. And the main elements, as I said, you must have a license to provide most nutrition services, titles, and even some forms of speech. If we look at a really restrictive state like Ohio, Ohio says it's against the law to even educate someone about food and nutrition. I call bologna sandwich on that only because that's your right, your freedom of speech. But that's just kind of what we're dealing with. With these restrictive red states, we're dealing with a very entrenched monopoly, very strict laws, very strict rules. And so it's up to the council to try to find the pathways around that. And one of our best pathways around it, which I'm going to talk about later, is the general health and wellness exemption. This is in every red state. It applies to every red state. And it's really how you're going to be able to practice and build your practice without much harassment. Now, in some states in all the states that we know that require a license to talk about food and nutrition, they also tend to restrict the use of the title nutritionist. So we have to be very, very careful if you're in a certain state that restricts the use of the title nutritionist, which there are quite a few here. So you have to be careful that if you are in, for example, Washington or Alaska, or let's see, actually, I'm sorry, that's incorrect. There we go. So these red states all have laws that restrict use of the word nutritionist. Some states that might be otherwise friendly to us also have laws that are restricting the right of the use of the word nutritionist. For example, Kentucky, Virginia, New York, Washington State. These are great states to practice in. There's no law limiting us. Pennsylvania is the same way. But that state does say you may not use the word nutritionist. And we also have to be careful when we use the word certified. Now, we may have a credential and we may be able to call ourselves a certified blank because we've earned that title and we believe we can use that title. But we want to be careful in using that word certified, because when we're working in the States and you put out your marketing materials, for example, and you say, hi, I'm Jonathan Posey. I am certified by Hawthorn University, or whichever. You know, I don't want to put words in your mouth, Paula, but when you have that certification, you want to be careful how you use that word, because the state and the dietitians will look at that and say, are they trying to give the impression that they are certified? Or might a reasonable person look at that and be confused and think, oh, they're certified by the state? So you want to be very, very careful with that. And of course, again, if you have questions about that, if you're concerned and you want to use the word certified on a business card or a pamphlet, reach out to me. I'll help you come up with exactly what's that to say. As well with nutritionist, if you're really concerned about how to use the word nutrition or the word nutritionist, just let me know and we'll try to figure those out. Now, another thing you're going to see a lot in the laws, and you're going to hear about a lot, is medical nutrition therapy, or MNT. That is essentially the use of nutrition to diagnose and treat and cure diseases and medical conditions. This is the one that the dietitians really want, because dietitians, or excuse me, I shouldn't say dietitians, because my gosh, there's so many wonderful dietitians out there. It's their national lobbying organization very much wants them to be seen as medical professionals, to be able to diagnose and treat diseases alongside of a doctor. And the reasons for that are varied. There's a lot of prestige with that. There's the ability to practice, do private practice. So you don't have to practice in a hospital, for example, but you also get access to certain insurance markets, certain Medicare, government insurance programs and things like that. So we tend to see MNT a lot in some of these laws, and it's something just to be kind of aware of. I like Nebraska's law only because it is a 44-page law, or no, it's a 3-page law with about 44 pages worth of regulations. And it was kind of the first state where we started to see MNT back in the day. And it specifically pulls out those things about assessment of nutritional status, treatment, diet modifications, specialized nutrition support. It's these kind of almost clinical words that you'll see that really kind of give you, oh, this could be an MNT state. Now, if we look at Mississippi, Mississippi has another one that says medical nutrition therapy is a nutritional diagnostic therapy and counseling service for the purpose of disease management. So it's pulling a little bit away from the medical side of things, but still very much talking about disease management. Ohio, which is the crown jewel of the Academy of Nutrition and Dietetics, is the one they really fight the hardest to protect, says that, you know, specific nutrition services to treat an illness, injury, or condition using nutrition. It involves assessment, it involves intervention, it involves counseling. This law is really expansive, and it uses a lot of these adjectives to really kind of place what we do out of bounds. So when you're working with one of these MNT states or a red state, you need to first just be aware of what the law says. And that's where the website, and that's where I can help. Because Hawthorn is a very generous member of the council, we can set up a time to talk by phone, we can work by email. I will help you go through the law, and we'll figure out exactly what you need to do for your practice. Now, one thing a lot of folks love to do is telehealth, telepractice, working over the internet as a holistic nutritionist to help a person's diet, to do meal planning, to everything like that. Well, again, depends on where you're at. So let's say you're in Ohio and you want to work over the internet with someone in Colorado. Colorado has no law whatsoever restricting the practice of nutrition, specific and most importantly, holistic nutrition. But if you were to work with that person from Ohio and the dietetics board were to find out, they might send you a letter or come knocking on your door and say, I'm sorry, you may be working over the internet, but as far as we are concerned, you are working within the state of Ohio, practicing dietetics without a license. So that's very cautious to keep aware of it. Just because you're working on the internet does not automatically mean it's legal. Now, we've been really pushing hard to try to get a telehealth exemption into some of these laws. We haven't had a lot of success, but we did get North Carolina last year, or 2 years ago, excuse me. When we flipped that state, we were very fortunate to get in a provision that said, as far as telehealth is concerned and working with teleservices, if you're exempt from the nutrition licensure law, which we are, then you are also exempt from any telepractice restrictions. So that's really, really important. And we really try to push those through. So we'll move along here. Let's see. So another point, some points to point out: no federal law restricting the practice of telenutrition. So that's great for us, but we have to go state by state. And again, it's where you physically are going to practice. Now, jumping into the exemptions, these are the things that are going to allow us to work, allow us to build our business. Most of the restrictive states have general exemptions in their law, such as for the military, if you work for the government. Some states have an exemption that if you work for a nonprofit and food, diet, and nutrition is within your scope of practice for that nonprofit, then you're exempt. That takes place in a few states, so we're kind of mindful of that. Dietary supplements is generally allowed in most of these states. There's sometimes a difference between the sale, promotion, and the explanation of the use of those dietary supplements versus recommending those dietary supplements. Even though supplements are technically completely legal, there's no laws restricting them, if you're in a red restrictive state, be careful not to use that word recommend or prescribe, because then they might say you're recommending vitamin D to treat some kind of an illness. You want to advise your clients on dietary supplements, advise them what the law says or what you believe it is, and then let them make that decision on whether or not they want to take it. So you just provide them with that information. Of course, if you're working under a supervision of a registered or licensed dietitian, you're completely exempt. In some states, if you're working under another licensed professional, specifically a licensed doctor, then you're exempt. Other states say that if you're a licensed nurse or a chiropractor, massage therapist, you're completely exempt. It really varies which state is which. New Jersey is a state where we are completely free to practice, but we spent most of 2019 fighting a trench warfare to keep it so. We almost lost New Jersey. And one of the things we had to be very, very careful with in New Jersey is that they have exempted all licensed professionals. So if you're a licensed optometrist, for example, you can talk about food and nutrition without a license. There's nothing that talks about if it has to be within your scope of practice. So what we talk about at the council when it comes to these red states, we are speaking about working with individuals or groups. A lot of folks want to work with individuals. Totally get it. Absolutely. That's what you were trained to do. That's what you do best. And that's what's really going to help people. But when you're working in a restrictive state, you have to change the way you talk. So instead of saying, Paula, tell me about your childhood. What did you eat? What did you eat growing up? What's your cultural connection to food? What kind of foods do you like, not like? Those are kind of questions that you can ask in the beginning in terms of building a baseline and understanding your client. But when it then comes to actually providing the information, the services, so to speak, to your client, you can't individualize that. And what I mean is that I cannot say, okay, Paula, you told me that you really love green beans, spinach, and cornflakes. So I have made sure to make you, I should have said cornflakes probably, but I have made you a series of meal plans for the next month that are going to be in what you want to eat, that are going to be healthy and nutritious. I customize them just for you. That's individualized services. So you have to be very careful that you're not making it seem like you're customizing anything for that client. So what we use is my favorite thing called the imaginary friend test. Now, if your client comes to you, you have to kind of think to yourself, okay, I'm in Ohio or I'm in Mississippi, and the law is really restrictive here. I have an individual sitting in front of me. This is an individual client. How do I talk to them? Pretend they have an imaginary friend. And everything you say to your client must apply equally to that imaginary friend. Sounds a little weird, but if you talk a lot, if you say it like that and you work like that, if you just pretend you're talking to a group rather than an individual, everything that comes out of your mouth and all the stuff you're providing is going to be on point. It's going to be general health and wellness information. You're going to be sourcing it from places like books, journals, blogs, articles, textbooks, YouTube videos. As long as you're not the one personally writing it and customizing it, it's completely fair game. Same goes with meal plans, all of that stuff. It's completely fair game. So when you're working in one of these restrictive states, you just have to change a little bit what you say. And of course, I'm happy to go through with all of that and help you. When we spoke about earlier the word nutrition, of course, you want to be careful when you use that word nutrition. I say usually it's best if you're in a restrictive state to just not use that term in public. Don't put nutrition on your marketing materials. Be careful how you use it when you're speaking with groups, just because that word nutrition kind of is a trigger, so to speak, for kind of the medical industrial complex folks that really don't like us and want to try to put us out of business. They listen for little words like that. So just keep that in mind. Now, Florida, last Thursday was a really momentous day for our community. We passed legislation through the entire legislature that completely exempts holistic nutrition professionals. And it kind of comes down to this. You don't need a license anymore, which is huge because we've been working on that state for 3 years. The license is not required for information, wellness recommendations, or advice concerning nutrition. That means you can't do any type of disease management, diagnosing, treating, curing diseases. You can't advertise the fact that you perform disease management or that you can help someone with their diabetes. You're gonna have to change the way you're saying that, like sort of like you're going back to a red state. You want to change it to say that I can help you with the precursors to diabetes. I can help you with some of the familial things that lead to diabetes. I can help you prevent diabetes. So again, changing what you're saying. You also cannot work with a client who is currently under a physician's care. Now, a little caveat here, because this is one we had to fight really hard to get. We had to fight against, and we were kind of forced to take it at the end. But it's that if a client comes to you, you need to have a question within your intake form that says, "Are you currently under the active supervision of a medical doctor?" So what I'm saying is, I went to see Dr. Bartholomew. And she is treating me for diabetes. I am currently under her care and working with her to treat my diabetes. If that's the case, then as a holistic nutritionist, you cannot work with them. Now, this does not include obesity and weight loss. So that's really, really good. So if a doctor is working with someone on obesity, you can absolutely work with them as well. And always, you should communicate with your client's medical doctor, whether they are under active care or not. But that active thing is something we're still trying to tease out and figure out. It's going to take us roughly 3 months, I'd say, until we really finalize the rules and the implementation of this new law. But for now, no license is required. Don't talk about disease management. Don't advertise disease management. Be very, very careful if someone comes to you and says, "I'm already working with my doctor." Otherwise, you're fine. And I would encourage all of you in Florida to go ahead, start building your business. If you've kind of restricted your business because of this, start planning to open it wide open, because this is just the greatest thing to happen to our community in quite some time. And it's part of the reason why, if you'll forgive me, I'm a little scattered this today, because I've been exhausted from working so much on Florida. So next states we're going to work on that we have some problems going on. We got a legislation in Pennsylvania that we're tracking that's trying to create a restrictive license. Pennsylvania already has a license, but it doesn't prevent you from practicing. The dietitians are trying to make it so that license is required for everyone. So we're fighting against that. New York has legislation every single year, and we continue to defeat it every single year to require a license. We're also monitoring Washington and California and Connecticut, because for some reason, the dietitians have sent their head lobbyists out to those states. And so we're just kind of trying to monitor that a little bit. There's some legislation down in Mississippi that on its face looks interesting, but we're actually suing the state of Mississippi. And we're suing the state of Florida, by the way. Our lawsuit is still going with Florida, and if that lawsuit is successful, the entire law goes away. So we're suing Mississippi, and in response to the lawsuit, the Dietetics Council kind of put forth this weight loss prevention. It's completely meaningless. It's a lot of words that means nothing. So we're going to defeat that, which is really interesting. So I'll probably have more news for you later with what we're doing. If you want to keep up to date with what we're doing, of course, go to our website, sign up for the newsletter, sign up for the action alerts. I tend to send those out pretty regularly. So with that, I'll be happy to take all of your questions. No question is too esoteric or too simple. Please ask all of the questions you want. And again, I truncated this. There's quite a bit more we could have gone through, but I didn't want to overload you with Florida, because Florida is going to be on everyone's mind. So, Paula, thank you very much.
Yeah, I'm here. Thank you, Jonathan. I want to let everybody know it's time to ask your questions. Please write your questions into the question and answer panel now. If you are just raising your hand, I cannot call on you so that you can speak. You must type your question, and then I can be able to pose it for you. All right, there's some good things here to review. But first, I just wanted to give an example of advocacy and how much it matters and how much our personal actions and it really influence the legislature. Back in, gosh, it was early 90s, and the registered dietitians were proposed a law changing regulations that only they could practice and nobody else could in terms of nutrition services. And it was poised to pass without any opposition, but being California, word got out and we stormed Sacramento en masse and let the legislatures know our position. And they said, oh my goodness, thank you so much for informing us. We had no idea. We thought the registered dietitians were the only one in practice with health and nutrition services. And so this gives us great pause. So we kept coming and kept showing up and kept writing. And goodness, you know what happened? They passed the law, SB 577, the Freedom to Practice Act. And it's a very open law that has been contested several times since, but has held, and as Jonathan says, it's going to be contested again. It says that any unlicensed health practitioner has the right to practice as long as we stay within our scope of practice and we abide by a few simple guidelines. We disclose our education up front. We disclose our fees up front. We'll talk to our clients about what they can expect from us and what we expect from them. Basic common sense things, right? But these were the issues that we're facing, and goodness, that law has changed. So I'm telling you, it matters. Our personal involvement really matters. Yes, Jonathan.
There's one more thing you need for California, and that is a sign. The state requires you to put a specific sign in your place of business or on your website. And if you go to the council's website for California, which it's holisticcouncil.org/California, but you can also find it through the Law and Policy. There's a link there for you can easily print out or download the PDF of the sign that you need. And it goes through all of those things that you just said.
Thank you.
So that is required. And they also tried to do that a couple of years ago with the naturopaths and the traditional naturopaths. They were trying to put them out of business, and we were able to stop that. But on advocacy, Paul, I'm very happy that you brought that up, and I would like to come back and do a full advocacy webinar, because to give you an idea of how important your advocacy is, when we started North Carolina to defeat that law, we had 3 people. By the time we finally passed that law, we had, I think, 65 different practitioners across the state, and they all had something to do. And what those things to do were to call, were to send emails, were to use a script to reach out to friends and reach out to colleagues and convince them to come on board. In Florida, we didn't quite have enough people like yourself helping us. We actually had a very large government relations team. I hired a lobbyist down there to help open some doors for us. I think if we'd had the advocacy from the practitioners in full, we could have flipped Florida years ago. You know, there's about anywhere from 3,000 to 5,000 holistic nutrition professionals, depending on which side of it you look at and which school you're looking at in the state of Florida. If we could just get 1,000 people in the state of Florida to send emails, send action alerts, make phone calls, I think we could have flipped that a lot sooner.
Interesting, yeah.
Yeah, I mean, yeah, it's very critical that you take action, that you forward the action alerts to everyone you know, that you take the time to call your elected officials, call them every day. You know, we have to create noise and numbers. That's the thing that gets us. Yeah.
One other thing I want to, before we continue with questions, is to point out that this webinar is in no way intended to denigrate registered dietitians. We are explaining the state of what we're up against and why. And, you know, I have great regard for registered dietitians. We have faculty at Hawthorn that are registered dietitians, and we're proud to say so. The difference is that there's an entire coalition within registered dietitians that have formed and are openly embracing holistic concepts.
Yes, and
And it's
it's
changing
absolutely
the
wonderful.
practice broadly, right? It's wonderful.
They're
And
coming to us. They're coming to me now. I have registered dietitians coming to me now and saying, how can I get involved? How can I practice, holistic health? I'm not happy with being a dietitian.
Mhm, mhm,
It's absolutely fascinating.
mhm. Well, there's an avenue, and we can put out some information after this webinar for the name of the organizations, the things that people can get in touch with. But I wanted just to make sure that that was
Yeah.
very clear right up front. All right, here's another question. This person is practicing in Illinois as a licensed professional clinical counselor, wants to know if she is exempt and therefore allowing her to practice nutrition.
So I'm sorry, I heard Illinois, but read that middle part again. Is she licensed?
She is licensed clinical counselor.
She's a licensed clinical counselor.
Yes.
So if you are licensed, you are exempt, so long as what you're providing is within your scope of practice.
Okay.
I actually have a lot of social workers and counselors that reach out to me about this because they want to help their patients with better eating habits to improve their overall well-being. If you're licensed, you're completely exempt in Illinois, so long as you have documentation or something from your license association that talks about food nutrition and is something that's within your scope. Certainly, if you're a licensed roofer or a licensed plumber, for example, well, just because you're licensed doesn't mean you can provide nutrition. It's got to be
Scope of
somewhere
practice
within the
matters.
practice.
Well, let me clarify this a little bit further for her.
Please.
As a licensed therapist, she's educating her clients on the role of diet in their mental health and may
Excellent.
recommend supplements such as probiotics, vitamin D, etc.
Yes.
She
Yes.
doesn't advertise that she treats disease. She doesn't consider that she is doing so. And she documents in her chart that she is educating her clients on nutrition and diet. Is this okay?
Brilliant. You can actually go further. You don't have to just do education. You can make individualized, specific recommendations and advice. You're licensed. You're a licensed healthcare professional. You're exempt. Hard stop.
Mhm. I love that. So next question. How does somebody in any particular state get a license? How do they apply? Who do they go to? What organizations?
Well, the license, or the only license that qualifies you in restrictive states to talk about food, diet, and nutrition with individuals is the registered dietitian credential. And to get that, you need to, I think now, have a master's degree in dietetics, and you have to complete about 1,000 hours of supervisory practice and then take the exam. That's the only way to get a license in these restrictive states.
I think that might overstep there a little bit. I think they need to hold the title of registered dietitian. They don't have to have a master's degree. A registered dietitian only has a bachelor's degree. They could
They're
have a
changing
master's,
it.
but
They're changing it. It's to get the registered dietitian credential, you're going to need a master's degree.
okay. In any state.
And well, only in those states. So you only need a license where a license is required.
Right. I
So
meant any restrictive state, sorry.
yeah, so if the license is required, the only license that's recognized in most of those states is the registered dietitian. Now in Florida, there is a way to get through using the CNS, Certified Nutrition Specialist, to get licensed. I think in New Jersey, you can now get licensed with the CNS, and in North
Yes.
Carolina with the CNS.
Should be, yes.
But
So
Florida's a little weird.
well, in Florida and other restrictive states, they're restricting the title of nutritionist. But if we qualify ourselves as a holistic nutritionist, which is what we're qualified to and educated to become, is that safe?
No, that's a very good question. So according to, and I want to echo what you said before for a moment. Nothing I say is in any way to demean dietitians. There are tremendously wonderful dietitians, but we have this lobbying organization, a national lobbying organization that views us as a danger to public health, and they want to protect and hang on to their license, their practice act. In fact, I couldn't find it. I'm sorry. I had a little graphic, a little screenshot of what the Florida Academy of Nutrition and Dietetics were telling their folks, they were declaring victory in Florida because they saved their Practice Act. So that's what we need to work against now. So I'm sorry, what was your questioning? Excuse me, I completely left my mind.
Holistic nutritionist, can we call it?
Holistic nutritionist. So even though yes, you're a holistic nutrition professional, you're a holistic nutritionist, but in those restrictive states, you won't be able to use that title because according to the A&D, every dietitian is a nutritionist, but not every nutritionist is a dietitian.
What if you don't say IST? What if you say holistic nutrition professional? I mean, it's semantics here. Holistic nutrition professional.
Gosh. It is semantics, Paula. Oh, my job is 55% semantics. Oh, yes, that's a very good point. You can use the word nutrition.
There you go.
And as long as you're using it carefully, I say carefully only because when you put, if there's a flyer sitting at a CrossFit gym that says, hey, Paula Bartholomew is a holistic nutritionist, she practices holistic nutrition or she provides holistic nutrition, someone could look at that who doesn't like us, like a dietitian or the Dietetics Academy, and they can say, they're practicing dietetics and nutrition without a license. It says right here, nutrition. So that's out of an abundance of caution. I just say, folks, be careful with that word. You don't want to draw any attention.
And also stay within your scope of practice. We do not diagnose, we do not treat, we do not cure. Those are words that we do not use, and you're taught at Hawthorn very clearly in your business courses, etc., in your counseling courses, that these words, you better not say them.
I am so happy you have those business courses because a lot of programs don't have that, and so I'm very glad you have that.
Well, you know, it's one thing to learn everything about nutrition and how to work with clients and groups, etc. It's another thing to
build a business.
to build a business around it. How do I do that, right? So yes, a very, very important component. And if anybody, you know, it's like some of the programs, the business course is new. So if anybody's online or listening and you've taken a program at Hawthorn before and you didn't get that business course, come right on back. You can take the individual course. You don't have to have the whole program. Happy to provide that. All right, let me see here. We're coming to the end of questions, but I still see that we have one attendee with a hand raised. So if you have a question, please type it in now.
And we can do this again, Paula. There's, especially after May, when a lot of the state legislators wrap up, I can come back and do this for you every month if you'd like. We can also do the advocacy course as well. I can expand this one here.
All right. You know, I think it might be interesting just, you know, give people a couple more minutes to ask anything, Jonathan, but would you talk about what does it take, you know, from the beginning? How do you identify a state that you are going to approach, and what does it take to change a state laws for you?
I haven't been asked that question before. You're so full of good questions, Paula. Thank you.
I'm an inquisitive mind.
So the way we identify a state that we're going to go after at the council is we first look at the law and we try to figure out what can we do to change it. We come up with that idea. What's the actual change that we're trying to make? Then we kind of look at the makeup of the legislature. Is there, you know, is it Democratic led? Is it Republican led? Is there someone in the legislature who is responsive to holistic health? Is it a legislator that is interested in reducing barriers to entering the marketplace and building a business? So for example, Florida was one of those great states where we said, okay, it's a Republican dominated legislature. Republicans tend to favor less government, less licensure. So we have an option there. We hunted down and we just found a legislator who was just very gung-ho of reducing licensure. And then we had to we went and talked to the governor, and the governor said, well, I'm going to put out legislation of my own that's going to do this. And that's how we got in. But when we're talking about a general state, so let's see. The first thing I look for is how active is our community in that state. If I put out a call in our Facebook group, Nourish the Roots, which is where we publish action alerts and a lot of discussions about advocacy, or through our newsletter with our community. If I can't get at least 5 people to attend an advocacy webinar, it's not a state where we're going to spend a lot of time. You know, we have to have you on the ground, because we have to be able to call a legislator and say, not only am I calling on behalf of the Council of Holistic Health Educators with X number of schools, X number of practitioners, but I got to be able to back that up. And if I can't bring a practitioner to their office to talk, or I can't get a practitioner to say, here is my state representative, and I can call that state representative and I say, I am calling in reference to this practitioner, it gets very, very tough. State legislators want to help their citizens. They don't tend to like groups that come from out of state and try to change the law without any type of a base there. So the first thing I look for is how active. How many people do I have in that state? How many people practicing, and how active are they willing to practice? Now, we don't have to have a lot either. So I'm going to be working on Nebraska. Nebraska doesn't have that many folks practicing holistic health. In fact, I've only been able to come up with 4, but I've got 4 people. I've got 4 people who are vested and interested in pursuing it, and they're willing to do the work on the ground. Now, flip side is that if I had $20,000, I would just hire a lobbyist to do all that work for us. But we don't have that much money yet. So it does fall on the practitioner. So if I've got a good group of practitioners and they're willing to show up for the advocacy webinar, which is about an hour long of lobbying and advocacy, and they're taking it seriously and they're willing to put in the effort, we're off to the races. And the council will then provide them with everything they need. From there, it is just repeat, create noise, create phone calls, emails, talk to the legislators, convince them that we're harmless. We help people. We don't hurt anyone. Because the other side is telling them we're killing people. So we have to counter that in person or through phone calls or through emails. And then we just slowly drive it home. That's what we have to do. And that's how North Carolina came about, because of a lawsuit. But it took our practitioners, holistic nutrition professionals, going and speaking with them in person to really tip the scales.
Sure, it did. And I'm proud of Hawthorn students and graduates in Florida who showed up. I mean, you let us know, Jonathan. I put the word out. We put the word out, and very fast response and strong response, because it matters. And so knowing, being informed and being able to know, I mean, the people that didn't even know that that this was being proposed. So it made a difference, didn't it?
Well, it did, and it's also, a lot of folks don't realize the Council of Holistic Health Educators has one staff person. That's me. I'm it. And so when I'm looking at a state and whether or not do I want to work in that state and try to change the law, I have to just kind of see what kind of resources do I have. That's one of the reasons I'm so thankful that CrossFit supports the council. Not everybody agrees with CrossFit. You won't find me in a CrossFit gym, but they support us, they support our mission, and they're willing to put the resources behind us. So, okay, I've got CrossFit. If I can come up with 15 practitioners in Ohio, I've got 15 bodies I can put to work and give them tasks to do. Great. Then with those 2 in place, I can then start to build a campaign. And then I can start going out to some of the schools and some of the supplement companies and some of the affiliated industries and saying, I'm raising money specifically to get a lobbyist in Illinois. I've got 15 practitioners who are ready to roll. They're all trained lobbyists ready to go. I've got CrossFit supporting me here. Then what we'll do is we'll try to find a think tank. So for example, in Ohio, we have the Buckeye Institute. They are very much wanting to change these licensure laws. A think tank like a 501c3 nonprofit think tank like the Buckeye Institute is very instrumental, because they are viewed a little more favorably, and a lot of the legislators have a personal relationship with them already. So that's another piece of the puzzle. So we're kind of bringing this whole coalition, so to speak. So once we have stakeholder, practitioner, we get an on-the-ground local asset like the Buckeye Institute. Sometimes we might pull in the Institute for Justice. So the Institute for Justice, when they filed suit against the state of Florida, and the way it's looking is that when it eventually works its way through the courts, they're going to win, and they're going to take down the entire law. So that put a lot of pressure on the legislature to fix this.
Mm-hmm.
So those are the kind of things, because it's just me and because we have very limited resources,
Mm-hmm.
it's important that people show up. And the other thing, if I may, and I hope you won't mind this, Paula, if I say this, those small donations that we get from practitioners, $10, $50, $100, they really, really help. You know, it costs $200 or $150 to go round trip to New Jersey. So I had practitioners giving me $50, $25, $100. That got me on the train and got me up to New Jersey to talk to the legislators. Same with Florida. I was raising money, and every time I got enough for a plane ticket and a night in a hotel, I was down there. And eventually I found someone where I just started sleeping on their sofa. So that saved a lot of money.
Mm-hmm.
Yeah, so those are the kind, I mean, does that kind of give you an idea of how we decide a state and how we pursue it?
Sure, it does. Thank you. And
Okay.
you know, just back to advocacy and your willingness to come back, I'm sure that there has been advancements in the information that you have to offer, but I want to remind you and our listeners that you have spoken on this topic before, and that was a very good webinar, and it's archived, and it's
Mm-hmm.
in our archived webinar section on our website. So you can search it by searching Jonathan Posey, searching the search word advocacy, and be able to listen to it too before Jonathan comes back.
You'd be amazed. I've gotten so many of your graduates from that video. They're like, "Oh, hi, wow, you're wonderful. I would love to speak with you."
Mm-hmm.
So yeah, that one's a wonderful video, and certainly I do want to come back.
Okay. So another question, we're gonna circle back to Illinois again. She was told by a presenter at an ethics conference put on by the licensing board that I need to ask them directly if she can practice nutrition counseling legally, because you're saying because I'm licensed therapist that I'm allowed to practice nutrition counseling. Does she need to notify her licensing board to get their permission, or notify her malpractice insurance? Does she need a special clause for
Not that I'm
nutrition?
aware of. As long as she can document that it's
Mm-hmm.
within her scope of practice.
Mm-hmm.
You know, I often talk about who's going to come knock on your door. Remember telepracticing? Who's going to come knock on your door and have a problem with you? If someone comes to you today and says, you know, I have a report here that for the past 6 weeks you've been working with your patients and clients on teaching them about food, nutrition, and how it can help them with their mental health. Is this part of your scope of practice? And if you're able to pull out documentation from your national association or your school or your licensure board that says, yes, food and nutrition is an important part of mental health, and talking about that with patients is what we do, there's nothing they can do, because the law clearly states if you're a licensed healthcare professional, period, you're exempt, full stop. There's no qualifying there. There's no, you know, only if it's this or only if it's that. But I take it one step further, because they're not just going to say, oh, you're licensed, cool, have a nice day. They're going to want to see the documentation. And as long as you can provide that, you're fine.
Okay, thank you. So one more question. You know, certainly at Hawthorn, the education you receive and the certifications or degrees that you earn allow you to practice within your scope of practice and within the training that you've received or that you also have additionally. And then there's also, you know, the encouragement to take advantage of becoming board certified. And there's 3 different options for that at this point. It adds another layer of credibility for sure. However, so the question is, how does sitting for the board exam and gaining their certification help with the legal status and practicing in any state, if at all?
Unfortunately, it doesn't. I get this question at least once a week. It's a very nice thing to have, because it does improve your credibility. When I am talking to legislators, I will pull out a board certification sometimes to show them that this person is qualified. Here is the board certification they have to sit for. Here's their ethics. They're reputable. Oftentimes, though, the problem we have in advocacy is that legislators don't really care. It's terrible to say that, but they view us as a turf war. And that's the really upsetting and unfortunate part. We can present their board certification, we can say how great it is, but they just see us as a licensed industry and us as someone trying to get access to that. So
it's because they were educated for that, and it's our role to change that opinion and their attitude and present ourselves. We're humans. We're humans that are offering ourselves to be of service to our communities.
Right.
You know, so if we can come up and speak for ourselves and speak to our education and speak to our goals and why we're doing this work, it will matter. You will make a personal impression that will last.
Yes, it's really tough because every legislator is different. My experience is that most of them just see it as a turf war, and it takes a long time to kind of warm them up on the science side of things and what we do. It's often easier to just talk about how we're being kept out of the marketplace and all the good work we could be doing to help people. So, and that was kind of half of your question. And could you remind me, what was the other half of that question?
If she was, I think you answered it already, that if does board certification matter?
Okay, yeah, I'm sorry.
Able to practice in any state.
Yeah, it helps for marketing. It definitely helps for marketing. I think it definitely helps for our credibility. It definitely helps for our credibility in talking to legislators, but it's not really as powerful as we'd like it to be. Now, let's hold that thought for just a moment, Paula. If I could bring 35 board certified holistic nutritionists to the Capitol one day and have them march through the Capitol meeting with their legislators, totally different story.
Yep.
Absolutely a different story.
Showing up matters. And at least, you know, at least initiate a phone call. At least start writing letters. You know, if you're living in California or Washington on the West Coast and you can't afford, and we can't fly to Washington right now anyway in this country. So you know, just current state of things, but we're leaving that aside right now because this isn't going to last forever. That showing up matters in any way. Calls, letters, in person. Matters.
Yeah, but for the board for the certification specifically, if I've only got one person with that certification, they're just kind of they don't really pay attention to that. I've not gotten enough traction out of that. But if I can bring in a lot of people, I can make something of that. I can make, for example, what we call a Hill Day, where we'll reserve a room in the Capitol and there'll be 30 of us. We'll have a few speeches, some preparatory, and then we'll all 30 of us go out knocking on doors of the legislature.
It's called a coalition, right, Jonathan?
Right. That is
huge. You taught me how to initiate a coalition and make changes.
When we had those 65 folks in North Carolina, they were from 9 different schools. And they were from 9 different professions. Some of them had board certification, some of them did not. But the fact that I had the numbers, that really, really helped. So, and I guess what this is bringing to, and I hope I can say this, board certification is great. Get it. It definitely helps for our image. It definitely helps for our credibility. But don't just let it sit there on the wall. Let's use that certification. Call me so I can start working with you to direct you to the legislature. Find others who have that board credential. Excuse me, I was saying certification, I meant board credential. If you have that board credential, don't just let it sit there on the wall. We need to do something with it.
Okay. All right, Jonathan, that is a good, I think, thing to close on. It's the end of our questions. So, you know, I want to thank you so much for what you've brought to us today and these important updates of what has happened, the successes that you've had, the challenges that you're facing, and letting us know the work that we can do to help support that and affect positive change throughout the country. Well, thank you for that. I want to remind you that the webinar was recorded and it'll be available on Hawthorn website under archived webinars in just a few days. And as usual, there's a short survey to fill out after the webinar ends. I can only tell you how much it helps us to have your feedback and any comments about this presentation and the webinars that we offer. So thank you for taking that little bit of time. Our next webinar, we're staying on a legal point of view here. Our next webinar is on April 7th with holistic lawyer Lisa Fraley, who we're
Yay!
inviting back, our favorite holistic lawyer. She's going to
She's our lawyer
presenting on,
today.
right? She's going to be presenting
Yeah.
further on the legal updates from her perspective. So that's another one to tune into. And then our next All About Alumni graduate interview is going to be on this Wednesday, April 1st at 12 noon Pacific time. And we have Megan Lyons, who's a graduate from our Master of Science in Holistic Nutrition program. She's going to be presenting on her postgraduate activities, her accomplishments, and her challenges. I'll tell you, this is one to tune into for sure. Certainly, we've had many previous terrific grad interview presentations. You can check those out in our archives. I can just tell you they inspire me again and again and again what our graduates are doing. There's tremendous stories in there that I hope that you check out because we want to inspire you. We want to inspire you to take care of yourself and hopefully learn more about health and nutrition from our webinar series and the courses and the programs that we offer at Hawthorn. So if you're interested in the work that we're doing, the programs that we offer, please visit our website and look for the more details. And for personalized attention, you can reach out to our director, Lizette Picasso. She's our admissions advisor. All right. Thank you, Jonathan. Again, this concludes today's presentation. I want to thank everybody for sharing this educational experience together. I want to wish you all the best of health. It certainly matters now. Take good care of yourself. It's of utmost importance. And I look forward to learning more together in our webinars and are all about alumni and within our programs. Until then, everybody, I'm going to continue to practice attending to my health as well as my compassion, my kindness, and my happiness, because what we practice grows stronger. So join me in this very important time for these kind of practices too. Thanks, everybody. Thanks again, Jonathan.
Take care. Bye-bye.
Take care.